Thank you everyone for joining us today. My name is Jason Resendez and I'm the Executive Director of the Us Against Alzheimer's Center for Brain Health Equity, which is building equity for communities of color and women who have been historically underserved by Alzheimer's health services, research, and formal care supports. I am beyond honored to be joined today by Dolores Huerta, one of America's leading voices and change agents for social justice. As co-founder of United Farm Workers with Cesar Chavez and founder of the Dolores Huerta Foundation, her work to build power for those who often go unseen in our society has made our country a more just, equitable, and welcoming place. Welcome, Dolores.
Oh, thank you very much for inviting me. It's a pleasure to be here with you.
You have inspired so many, including me, through your work. Can you tell us a little bit about your journey and your life's mission?
Well, I was very fortunate in my career, so to speak, to be able to be taught how to do grassroots organizing, how to bring people together. And we do it through what we call house meetings, something like Tupperware parties, for those people that know what that is, and to inform them, get them to understand what the situations are and what they can do to change their family situation, their community situation, and any challenges that they have in their community. And it's been very, very effective. We've been able to pass many important pieces of legislation through this process, and also making people understand that they have a responsibility, of course, to their communities, but also to engage in voting, to engage in advocating for legislation, for laws that will help us move forward, especially when it comes to caring for our families.
Amazing. And I know you've been with us before. You've talked a little bit about your personal connection to Alzheimer's. How has that experience of organizing and engaging communities shaped your views on supporting caregivers and families touched with diseases like Alzheimer's?
Well, I think now more than ever, we have seen how important it is to have caregivers supported in our community, because we know often they are not supported. Many of them are not in organizations that can represent them. We know that they are not paid enough, but they are a very critical part of our society, because we know that more and more people are going to be affected with Alzheimer's. We know that what's happened with the pandemic, that we have seen that so many people that were in nursing homes, where a lot of people that have Alzheimer's, they end up in nursing homes, and yet we found out that so many people were dying because of COVID. So many of the people that were attending them also were infected with COVID-19, and the whole system. I think one thing that the pandemic exposed, that there is many things that we have to change about the way that Alzheimer patients are treated. And they don't deserve to have a death sentence because they have Alzheimer's, or don't be put into facilities that are not safe for them to be in, or for the people that are supposed to be taking care of them don't have the proper training. And so when we know that Alzheimer's is something that's going to be with us for quite a while, until there is a cure for Alzheimer's, that we have to do everything that we can to make sure that people that are exposed or that get Alzheimer's, because we know it's something that's internal, until we find a cure for it, we have to do everything that we can, especially to support and to train the caregivers so that they don't have to have a death sentence when they have Alzheimer's, okay? That's the main thing. And we have to do everything that we can to raise awareness and to get the funding, especially for the caregivers that are going to be taking care of them.
Absolutely. I love your energy and your words. We have to do everything that we can. And that's why at Us Against Alzheimer's, we've been fighting for paid family and medical leave for caregivers, because we know that growing impact on dementia care disproportionately impacts Black and brown women who are often having to navigate care while working. I know you've also been outspoken about the need for paid family leave and paid sick days. Why do you think, how do you think paid family leave can make a difference for family caregivers providing care across the lifespan?
Well, we know that the best person to take care of someone that is affected with dementia or Alzheimer's is a family member, because they know what their likes are or their dislikes, what their personalities are like, and how to make them more comfortable while they navigate this disease. So paid family leave is absolutely crucial. And we do know that right now we do have the human infrastructure bill that is now in the Senate. And it's going to be voted on by our Congress. And this would provide some of the funding that I was talking about that is needed. So I think it's really, really important. All of us, and I guess everybody should care about Alzheimer's, okay? It's not selective, you might say. Almost every single family in one way or the other is going to be affected by Alzheimer's. So if we can all come together and support the human infrastructure bill, the $3.5 trillion, which sounds like a lot of money, but it really isn't, because it's going to be extended over 10 years. 10 years. And so that we can start doing something tangible, something immediate, that we know what the support that our Alzheimer patients need. We know the support that they need. So all we have to do is act on it by getting everybody to call their senators and say, please vote on this important $3.5 trillion human infrastructure bill. And I like to say human infrastructure because a lot of people say, okay, well, we're going to have the infrastructure bill for the bridges and transportation that we need. But I like to quote Senator Bernie Sanders, who said, it doesn't do you any good to build a nice bridge for people to sleep under it or to live under that bridge.
Everybody should care about Alzheimer's. I couldn't agree with you more. Everyone should care about Alzheimer's. It's something that's impacting our entire society, as our audience knows well. And I like to think about our work as fighting Alzheimer's is that we're fighting for families to have the right to remember their stories, remember their families. Because one of the cruelest aspects of Alzheimer's is that it robs you of your memory. So thinking about memory, Dolores, do you have a particular memory that keeps you strong during hard fights, like the fight right now for human infrastructure? What memories do you find to be the ones that give you strength?
Well, we know that luckily over my life, I have been able to fight to get the type of support systems that we need, and which many people thought that were impossible. Back in the early 60s, we passed a bill here in California that became a national bill afterwards, that people who were legal immigrants to the United States of America, if you had your green card and you were a legal resident, that you could get public assistance, because there were many, many of our elders whose children had gone off to war in World War II, and they had fought there and died there, and yet they were not eligible for any kind of old age assistance. And so we were able to pass that law just by coming together, but just by what I've been espousing a few minutes ago. And so that not only could elders get some kind of a pension, but they could also get disability assistance, and also aid to needy children, and this was an important piece of legislation. So sometimes when we think things are really impossible, they never are impossible, because that's a good thing about living in a democracy. We are the ones that can make sure that the kind of resources that we need, that we can make that happen, again, by calling on our senators and our Congress and our state legislators to give us the resources that we need.
Fantastic. I love how your memories are memories of fighting for social change and making folks' lives better. What an amazing journey that you've been on, and congratulations on your 91st birthday, that you are still out there in La Lucha doing the work and fighting for people. And that must be an extremely busy days, long weeks. What do you do to take care of your brain health during those long days and long weeks fighting for families and communities?
Well, I think it's important that we be active and that we be informed. So I love music. So when I wake up in the morning, the first thing I do is turn on the radio, and I listen to National Public Radio. I hear the music, and I make music a part of my life every single day. Of course, I'm like many of us, we're just on the Zooms and following the news and seeing what's going on, and then doing my part, that whatever I can do. I just came back from Arizona, where we had a press conference day before yesterday in front of Christian Cinema, Senator Christian Cinema's office, okay, with a lot of the organizations there that are trying to get her to vote again for this human infrastructure bill. So I think the main thing to do is stay active. I read as much as I can whenever I can get a break from Zooming and the other work. But I think the main thing is to do, we have to keep our brains active all of the time, and then do as much physical activity as we can. I try to exercise in the morning. Every morning I try to do my exercises and walk as much as possible and dance as much as possible. Any opportunity that I can. If there's some good dancing music on the radio, I'm out here dancing all by myself in my living room. Okay.
I love it.
You have to keep physically active.
I would love to dance with you sometime, Dolores. I think that's fantastic. Thinking about the senators, thinking about policymakers, what message do you have for them in this moment?
Well, we have to appeal to their consciousness and also to their own family histories, you know, because I'm sure that everybody has somebody in their family or somebody that they know that was affected with Alzheimer's. And to always remind them that as servants of the people, that their job is to, that's why they're elected, is to take care of the most vulnerable persons in our society. And who can think of people that are most vulnerable than people that have been affected by Alzheimer's?
In thinking about our audience, we have advocates from across the nation who want to make a difference on Alzheimer's. And you're just an amazing role model for anyone who wants to make a difference on any issue. Given your deep experience in advocacy, what's your number one lesson to share with these hopeful change agents who want to make a difference?
Well, we all have to become messengers. We all have to become ambassadors. We have the knowledge, and we're getting a lot of knowledge here today in this event, and to share that knowledge and to call someone that we know and have them call somebody else, so we can spread the message out there. And also because a lot of times, I think a lot of people think, oh my God, there's nothing you can do about Alzheimer's, okay? There's nothing that you can do. But we can say, no, there is something that you can do right now, because we can fight for this important paid family leave. It's important that we fight for the home care workers. And this is something that all of us can do. Si se puede. Remember, you have the power. We have the power. We have the people power to make this happen. Yes,
Si se puede. Dolores, thank you so much for being with us today.
No,
It's been an honor. It's been an honor to be with you. And I have to say on a personal note, my life, my work has been shaped by your actions and inspired by your spirit. So thank you so much.
Thank you very much. And if people want to learn more about the Dolores Huerta Foundation, we're on the web at doloreshuerta.org, doloreshuerta.org. Okay. And I know that this is a mission that we all have, and it's something that we can all do something about, and we can feel very, very good that we accomplished something very, very important. So thank you very much for having me be part of your event.
Thank you.
Welcome.